to Healthy Minds, a show where we discuss mental health issues. We are your hosts, LaShawn McCautry.
And I am Ronaldo Moody.
And today we're going to be focusing on mental health community services. After a mental health crisis, then what? What's the aftercare? So we'll talk a little bit about that.
Okay. So LaShawn, I know that a lot of people just don't know what is out there.
That's right.
And I want to share a few options that people may have in terms of community services.
Okay.
One of the things that people have out there to them is patient in treatment.
Okay.
They have in treatment services where you can actually stay in a hospital for psychiatric reasons for, a week, 2-3 weeks.
Are you talking about like a regular hospital?
Just a regular
Psychiatric hospital.
It's a psychiatric hospital.
Yes.
It's not an acute hospital. It's a psychiatric hospital.
Right. Okay.
And you're seen by a psychiatrist weekly, and you are seen by a therapist every day. They do individual counseling while you're inpatient, and they do group counseling while you're inpatient as well.
Okay. That's great. And so what if someone, and so that's one option. What about outpatient services? Someone, they're living with mental health issues and maybe they work, maybe not, but what are some other services that are out there?
So most inpatient treatment facilities, they also have an outpatient facility as well. And an outpatient normally it's structured so that sometimes they call it a PHP program, and then they call the step down an IOP program.
Right.
The PHP program is, for the most part, 5 days a week. You go there for 6 or 7 hours a day. It's like really intensive.
Is that like a day treatment program type thing?
Day treatment is different.
Okay.
Day treatment is different. When you do outpatient, outpatient is more intensive group therapy and individual therapy.
Okay. Yes. Okay.
So it's a little different.
Okay. So there is a PHP program and then IOP program.
Yes.
Okay. So tell us about the IOP.
The IOP program is a step down.
Okay.
It says you're getting better, but you're not quite there yet.
Okay.
See, the PHP was created so that people don't have to stay in a hospital.
Right.
When you're staying in a hospital, it's quite expensive.
It's expensive, yes.
Yes, very expensive. And your insurance may cover some of it, but it may not cover all of it.
Right.
So that could really put a burden on the family system. Right. So what the PHP program says is, all right, you don't have to sleep in a hospital, but now what's going to happen is that you'll come out, you'll be at program from 8 to let's say 2:30 or 3 o'clock, but you go home and you sleep.
And so is that PHP, does that stand for Partial Hospitalization Program?
Exactly.
Partial IOP, Intensive Outpatient Program?
Exactly.
Okay.
So in the IOP program, it's a step down. The therapists, the mental health professionals, the psychiatrists involved, they say, okay, here's your treatment plan. Let's work in this treatment plan. You're progressing in your treatment plan. So now it doesn't have to be so intensive with the PHP program. Let's step you down. So now you'll go maybe 3 days a week instead of 5 days a week.
Okay.
And eventually they'll taper you off so that it's not a big shock to your system where you stop treatment all at one time and you don't know what to do with your time. Because that's really hard for people.
Right.
They get all this fabulous treatment and then all of a sudden it stops. Now what do I do with my time?
Exactly.
So the IOP program is designed to help step you down slowly so that you can integrate some more community support systems and also integrate more of what do you do with your time? How are you going to structure your day? How are you going to make use of and be productive with your time outside of treatment?
And that's needed, right?
Very needed.
So other than those, anything else that would be, that someone can access in the community?
Yes.
Okay.
So when you're stepping down from a PHP program to an IOP program, You know, you're going to 3 days instead of 5 days a week. Then you'll go maybe 2 days and maybe 1 day. In that time, the clinical professionals, they're going to evaluate what type of services that you may need, what type of support systems are you going to need. And depending on the city you're in, they have a huge array of support systems that you can choose from. And if you don't have, and if it's not city structured, then they actually have faith-based community support systems that you can tap into. And also they have hospitals, they have some support systems there that you can tap into as well.
Okay. That sounds good. Now I know that there also, and this is not clinical, but in terms of some people with severe mental illness can access during the day, you know, different programs where it's more like socialization, which is needed. And I know that I used to work at a program where it's called ACT, and so that's where someone can get a variety of services where they are.
Yeah.
You know, so the clinicians would go to where they are and provide rehabilitation services.
Oh yeah.
And have access to monthly psychiatrist visits as well.
Oh yeah.
So that I know that that's probably available too, right?
Oh, that's very much available. When you get out of the hospital, and now you're trying to tap into these different community resources, depending on the situation, whether it be for depression, anxiety, addiction is very, very huge. Alcohol addiction and other types of drug addictions. The city, they have programs where you will have a therapist go out to your home, sit with you, work with you, structure how you see yourself progressing, what gives you purpose, what gives you meaning in your life, so that you start to rebuild that love for life. But
that's important.
Yeah, it's very important because we sometimes, especially with traumatic experiences, people forget how to be resilient.
True.
We forget it.
True.
So they have to be reminded and sometimes even retaught. And that's what these programs do. They have some programs where clinicians go to your home. They have excellent programs where you actually go to a community setting where you're involved with people who are just like you, going through the same thing you're going through.
Yeah.
So that you feel that support. And most importantly, you are able to tap into what other people are doing that works.
Right. Yeah, great. I think that was great. I mean, and I think there are a lot of people that can benefit from this information, kind of like next steps. Okay, so yes, there's a problem, and what I can do in the community, access resources I can access in the community. So I think that was great that you were able to kind of pinpoint what's out there, what's available, and what people can tap into. So we appreciate that. I think that was important.
You're welcome.